It is Friday, January 23rd, 2026. And yes, it is an All Things Advocacy special edition for the special session. Josh Askvig here with you. And as always with me is Janelle Most. Janelle, happy Friday.
It is a cold Friday in January, but it is Friday.
We are hardy North Dakotans. We're here. We're happy to be here. Excited. Janelle, why we're here. The North Dakota legislature just wrapped, and I just saw the post on social media. The governor's actually signed a number of bills for a special session. I would say this is unusual, but I will say at least in my tenure in the last 5 years, this is becoming more usual than at least I ever recall. But tell folks a little bit about what just happened in overview, high-level overview of why were we here, what's going on, and touch on that.
Sure. I think this is my second special session since I started at AARP, which is 6 years ago already. But it was really supposedly very narrowly focused. So every state was able to apply for what's called the Rural Health Transformation Grant Program. North Dakota was awarded $199 million at the end of last year. And so what the special session was intended for was for the legislature to give approval to the Department of Health and Human Services to move forward to really implement this really tremendous opportunity to expand healthcare services in rural communities.
Yeah, and so they met over 3 days. You said the intention was, the narrow focus was around the Rural Health Transformation Program. They did address a few other issues. In total, I think they considered, was it 12 bills that they considered in total?
There were 19 that legislative management originally looked at, but 6 were moved forward. And 4 of them in particular really were aligned with the Rural Health Transformation Program. So it's looking at, there were 4 policy bills that were moved forward and adopted widely by the legislature. The other couple bills we didn't follow as closely, but it is an opportunity for legislators to bring ideas forward. But really the focus was on how do we expand services in rural communities, make sure that folks can get the services they need in their homes, in their communities, so they can live independently longer.
Awesome. Well, let's dive into the rural health transformation dollars. Could be up to $1 billion over the next 5 years. You mentioned $199 million for this first year. What were kind of our priorities heading into the special session, and talk a little bit about where we waded in here?
What's interesting about this money is that, the legislature approves it, but they really didn't dictate who can access the funds. And I think that's what we were moving into this session really hopeful to see too. We want folks to effectively use that money in communities. Our focus was really on how can we help people age better in those communities. So more than half of the funds we'll use to connect rural residents to healthcare closer to their homes. So whether or not it's telehealth services, in-home care, rural clinics, what we know is that expanding that coverage in rural healthcare in rural communities, the onus won't be so much on you as a rural resident to go to one of the larger hub cities to receive services. The whole intent around this funding is to make sure that services that currently exist are expanded and enhanced. So again, telehealth, so making sure you can access services in your home to a healthcare provider, looking at decreasing the barriers for caregivers. We know a lot of folks are aging in rural communities, and we know they rely really heavily on family and friends to provide caregiving services, and really eases the pressure if you want to have in-home services. How can we make sure the funding's there, but also the staff is there to provide that? Our communities are only aging faster, and we know people don't want to leave their homes. And so how can we bring those services home to them, essentially?
Yeah, absolutely. Quickly, we know that a lot of this money is going to go towards our rural communities, obviously, the Rural Health Transformation Fund. It's really aimed at helping North Dakotans remain independent and not just independent, but in their homes, in their communities, which is something we hear from loud and clear over and over again, survey after survey, conversation. So you touched on it. The legislature didn't really, the legislature kind of did the easy part of the work so far. Now comes the real work. Talk about what happens now.
The real work does happen now. Department of Health and Human Services will have to be responsible for, releasing applications for folks to apply for these funds. They want to make sure that there are some services in place. So how can you expand those, enhance those services? But there's a really tight timeline. So I think what's important is that communities are probably already having conversations and have had conversations the last 6 months is, how best can they use the services available, get that money, because it's going to be a tight turnaround. They've got to make sure they have a plan in place by October of this year, and then it has to be spent by the following year. So this isn't really meant for construction or, building anything. It's really looking at what do we do well right now, and how can we do it even better for North Dakotans.
Absolutely. I think if you live in North Dakota and are concerned about healthcare access and healthcare dollars, I'd encourage you to talk to your local provider, your local nonprofit, public health unit, et cetera. Make sure they are aware that there may be opportunities for them to get some needed funding to enhance healthcare access in your community, specifically home healthcare access, if that's something you're interested in. Janelle, quick drop in today to give a special update on the special session, a special edition of the All Things Advocacy for the special session. We didn't have a lot of action for our members. This moved fast. I mean, the North Dakota Legislative Session generally moves fast. This was even faster, even though it probably didn't feel like it at times. But we know we're going to need help down the road on different issues and different initiatives. If you're interested in volunteering to write letters, lobby legislators, or present testimony at the state level or even locally on things, Janelle is your contact. You can always find all of our stuff at aarp.org/ND. And Janelle, we have a special opportunity coming up next month. You want to talk about Advocacy Connect?
Yeah, this year we're looking at a new, fresh way to get folks interested and involved in our advocacy work, which we're calling Advocacy Connect. So we'll connect over the lunch hour, talk to you about different opportunities, either locally to get involved or continuing to follow what's going on at the state legislature. Looking, how do you work with city commissioners? How do you look at your federal delegation? It's really an opportunity to essentially pull the curtain aside and say, how hard is it to do advocacy work? And we really want you to find small tasks of just, attending a meeting, or a larger task of attending a meeting with you and me to meet with our congressional reps. But voices are powerful, and we can't do our work without our volunteers. And so look for information coming soon. But again, it's February 18th. You can email me at jmose@aarp.org, or again, go to that aarp.org/ND, and you are going to find all the information you need. But it's a great opportunity to get involved.
Happy Friday, everybody. Stay warm, and we'll see you next time on the next All Things Advocacy with AARP.